Research is something where you involve everything under the sun.
What is actually transdisciplinary research?
There is a strong correlation between all this communicable disease with the mental health of that particular patient.
Who can be the potential collaborators you think?
Most important collaborators are clinicians.
How it is beneficial to the society or how it is currently benefiting the society?
Transdisciplinary research is about the society only, and it directly benefits patients.
Is there any future scope of research from this translational studies?
There's a huge scope. The industry partners and the government is looking forward to it. For transdisciplinary research, you need that every data and metadata of a patient.
The greatest discoveries happen when disciplines meet together. A very good morning to all the listeners. Today I am your host, Dr. Shantani. I will be hosting the 5th podcast of the series, Healing Power Within. So today we have with us Dr. Shuvojit Moulik. He is the professor and head of Department of Biomedical Research, Santosh University. He has been extensively doing work in cancer research for last 15 years. For last few years, he is also involved in transdisciplinary research. So now this is what today's topic is. What is transdisciplinary research? We will straight go to Dr. Moulik. I welcome you to the show. And first, I just want to ask you, since I have been following your research for many years, apart from cancer research, you are also involved in transdisciplinary research. So for all our viewers, I will just ask you to make them understand what is actually transdisciplinary research and what current scope it has in scientific aspect.
Right. So thank you, Dr. Shantani, for hosting me in this research, right? And yes, coming straight to the topic, that what is transdisciplinary research? Let me give you an example. So we have been working with various NCDs, non-communicable disease and communicable disease. Previously, people used to think that that is not related to mental health. Okay, it was only non-communicable disease, say for example, heart disease or kind of asthma, these kind of diseases that are directly related to mental health. But now, if you see the correlations between various viral infections, bacterial infections, parasitic infections, there is a strong correlation between all this communicable disease with the mental health of that particular patient. So this is where it gets transdisciplinary.
Okay.
So transdisciplinary research is something where you involve everything under the sun. So it can be like
Everything that is happening around us.
yes, that can be from behavioral studies, that can be from bioinformatics, that can be from clinical aspects, that can be from societal aspects, that can be from the demographic aspects. So, for example, I would try and give you a very small objective of one of my core research is to get geoclusters for people who are suffering, geoclusters for women who are suffering with cancers.
Okay.
But at the same time, like correlating their mental health and the physical health data. So this is how it will be getting closer and closer to a personalized treatment for cancer.
Oh, that is a great thing that you said. And I hope now I am getting a very clear picture on what is transdisciplinary research and also our listeners, of course. So, as from what you said, what I get is transdisciplinary research includes, as you said, anything and everything under the sun. The thing is that what the question coming to my mind is the next is we need collaborators for this. This is a teamwork. So who can be the potential collaborators you think who can be involved or who can get involved in this transdisciplinary research in scientific aspect?
Yes. So as I said before, it's a very, very broad topic and a very like it's been growing for the last few years, and then people are getting a grasp of it. But coming to the collaborator, the first and most important collaborators are clinicians, because anything that we are doing needs to be related to clinicians.
Right.
When we are working with diseases. So clinicians, then comes the partners. Like partners can be various universities, various people from national and international universities who are working both in humanities and medical science and other research.
Basic research.
Right. And at the same point of time, we have to include industry in this, because without industry, there's very less scope for growth. Now nowadays,
Yes.
and industry
Of course.
can be anything. That can be from diagnostics industry, that can be a pharmaceutical industry, that can be any, say for example, industries like MNCs and other companies who are working with informatics only. So because when you are working with transdisciplinary science, it involves big data. So
Right.
whenever you're involving big data, there's a complex network that you are going to set. So, and then to decode that network or to decode that particular like understanding, you need collaborators.
Right.
And apart from that, you would also need government bodies like funding partners, can be ICMR, can be TBT and other TSTs. But uh, in a whole, transdisciplinary like research involves almost everyone. So I can't even omit out any, even for example, a very small subject or a very different, an orthodox subject like, say for example, geography. But you would need people from
Right.
geography for
Yes.
transdisciplinary research.
Yes, if you are doing the geoclustering, you need some person from there, right? Thank you so much for enlightening us with this. As you said that this is a transdisciplinary research, the first impact on me, that is, it has a huge impact on society. Can you just make us understand how it is beneficial to the society or how it is currently benefiting the society?
So transdisciplinary research is again a very inclusive model.
Right.
Okay, because in our society there are so many people who are marginalized, and marginalized in various ways. Marginalized in terms of ability, marginalized in terms of sexuality, marginalized in terms of various other socio-economical parameters. So
Disability also.
yeah, of course, ability is
Ability, yes.
so, but transdisciplinary research actually brings them all in. So, for example, if we go to a tribal place and then understand the genetic predisposition along with their geographical or demographical advantages and disadvantages,
Okay.
you will understand how communicable or a non-communicable disease can occur in that particular cohort. So it's a very, very interesting phenomena in terms of societal benefit, because transdisciplinary research is about the society only, and it directly benefits the patients, because you are not dealing with only the symptom of the particular disease. Suppose someone is coming to you with a fever, so you are not taking up their history of the temporary history of the clinical history of the fever. You are taking everything, like
Right.
from how is their mental health status, how is their physical health status, what locations they are coming in, and what is their nutrition. For transdisciplinary research, you need that every data and metadata of a patient. So that is how important and how directly it benefits the society.
Right. So that means socioeconomic impact is also a great factor in this.
Yes. So that is very important again, that transdisciplinary research will actually decode and make down clinical implications very in a budget-friendly manner. So lower cost will there will be several researches which are happening now, which are targeting um, a particular cohort or a particular population and cutting down their out-of-pocket expenses. So that is again coming into the transdisciplinary research.
Okay, that is very much enlightening and very exciting to know these things. So my next question to you would be: is there any future scope of research from this translational studies?
Yes, transdisciplinary research has just started in India.
Yes, right.
It is very new, and people are trying to build in cohort, like intersectional cohort for this. If you see even the government is also very new to it.
Right.
I would just give an example of a recent grant that the government started only this year. It was a convergence grant. It's called a convergence grant, and what was it about? It was a convergence grant between humanities and STEM biology. So, or STEM fields. So, but the interesting part of it was being this government coming and the government department which started it was Department of Science and Technology, or DST, or
Right.
NRF now. So, and then they have never given such a grant for humanities, and here the humanities would be the primary PI,
Right.
or the primary principal investigator for the grant, and the other people from STEM would be
The collaborators or the
collaborators
co-PIs.
or co-PI. So you
Right.
understand that how the transdisciplinary research has
Right.
just begun in India. And to say the least, that everything, be it AI, we are taking it AI and taking help from AI from various kind of transdisciplinary, because we are again dealing with big data here. So AI is the future of transdisciplinary research, and AI being an inclusive platform also helps and builds and intersects various kind of biases that we ourselves have for our own disciplines. So that is something that is very important. The next set of future researches is again personalized medicine is going to come with transdisciplinary research. Again, cutting like having lower cost medicines and lower cost
Diagnostic
statistics,
tests. Right.
and diagnostics will be coming through the transdisciplinary. And then there will be various cases where people can choose from various set of treatment strategies through transdisciplinary research, because it can divide cohort to cohort. So depending on their various kind of mental health, physical health, and other status. Speaking about transdisciplinary research and the scope, there's a huge scope, and and of course the industry partners and the government is looking forward to it, because they want all the departments or all the facilities to work together, and transdisciplinary research is one of the basic place to start.
Thank you so much, Dr. Shubhojit, for enlightening us with such a huge knowledge on transdisciplinary research. So this is a never-ending discussion. So, I'll ask you questions, you can answer, but we have a very short time. So, thank you. I will again like to thank you for enlightening us with such a new topic, making us understand the scope of research under this. So, to all the listeners, I would like to say, I hope you have enjoyed all these podcasts from this, whatever we wanted to deliver to you. I will also want to say that we have to remember one thing: the greatest discoveries happened when disciplines meet together. So, stay tuned for more such discussions. Thank you so much.